So, can you turn your video on a bit? Where you are, can you turn your video on just for a few minutes? Good. Mine is on. Can you see me as well?
Yeah, I can see you.
Good. Amazing. Amazing. So, I'm recording now. So, we're just about to start. All
Okay.
right. So,
All right.
My name is Danny Mensah, and I'm your
Okay.
lecturer. Yeah, from Atlanta. I'm your lecturer for today. Like I did mention, we'll be looking at and digest Unit 11, which deals more of the contemporary issues within the health and social care. And for today, our main focus will be on LO1, which is the learning outcome one, okay?
Okay. Okay.
Which is more about understanding the contemporary health and well-being issues and the current databases related to health and social care. Okay. And
Okay.
one of the main area we are going to look into what determines the mark you get within the healthcare, So in determining the health and social care, we expect that the learner should be able to analyze the key health and well-being issues and the current database related to the health and social care in your chosen national context. For that matter, we're looking at UK because we live in the UK, okay?
Okay.
So we need to look, when we talk about the national context, the UK is what we're going to use as our case study and not any other country, okay?
All right.
And then so you can either achieve a pass mark or a merit mark. And when we say a merit mark, then you'll be able to analyze, but you also have to evaluate the impact of the media reporting of issues on the public responses. Obviously, when there are a pandemic or outbreak of bad reports against you can turn your video off now. You can turn your video
Okay.
off so you feel free. Okay.
All
Yes.
right.
So obviously if there are what do you call it? An outbreak of bad or negative reports about the health and social care or about the healthcare or any support worker or anything, it has huge impact against the healthcare, isn't it?
Yeah.
Yeah, so those things we expect that you should be able to evaluate them, okay?
Okay.
Yeah, to have to be able to evaluate them. So those are the things that we expect that you do, okay? We expect you do.
Okay.
So an overview, and I'm going to start the lectures, then we'll take it from there. So just 1 minute, and then I will share the screen and we are good to go.
Okay.
LO1. Can you see the screen as well?
Yeah.
Good. Um, so I've already explained that we are looking at understanding the contemporary issues and the current database in the health and social care. Okay, so let we start and then we could have some kind of discussions within the health and social care. Uh, so I did mention that in selecting your national contest, you begin by choosing a specific country. And this is when we finish the lectures, in answering your questions, we just have an overview, okay?
All right.
By choosing a specific country or region as your focus. This could be your own country or one that you are interested in studying, ensuring you have access to reliable data and information about the health and social care system in that context. And I said, for that matter, I use UK as your
Okay.
case study, okay?
Okay.
Okay. So We should be able to identify key health and social care issues, research about them, look out for reforms within the healthcare services. Okay, we look
Yeah.
at reform changes that has been proposed within the healthcare, public healthcare concerns, mental health challenges, elderly care, obesity, child health, substance abuse, healthcare access. Those are things that you need to look into. Okay. Once you be able to do that, you should be able to identify the key issues and dive into the current database surrounding these topics. Consider different stakeholders' perspectives, government, healthcare providers, patient advocacy groups, controversial aspects, media coverage, how these issues are portrayed in the media and influences media narratives on public opinion, policy discussion. So these are all things that you can look into.
Okay.
Okay. Now,
All right.
in analyzing the factors that influence the perspective, you have to examine the factors that shape different perspectives, socioeconomic factors, that could be income level, education, employment status, cultural and societal norms, attitudes towards health, wellness, and the role of the healthcare in society, political considerations, historical context, and technical advancement. Those are things that technological advancements you have to look into in addressing your issues.
Okay.
Now, you also have to look into the evaluation of the impact of the media coverage. We did mention that could get you into achieving a merit. In so doing, you have to assess how the media coverage and the public discourse influence perceptions and responses to these issues. Consider the bias and sensationalism, how media framing can shape public opinion and policy decisions. Public awareness campaigns, effectiveness of media campaigns in raising awareness and changing behaviors. Role of social media, influence of social media platforms on health-related discussions and informations disseminations, and ethical consideration, political harm, potential harms of misinformation or fear-mongering in media coverage. All right?
All right.
Okay. Then you draw conclusions and you can then give some recommendations. And then you can look at implementations of the policy and practice that may have, if there are new policies within the sector which will not be helpful, you talk about it. You then look at advice, areas of further research, and then look at strategies for public engagement. Okay.
Okay.
Okay. It says that you use data statistics to scholarly articles. You know about references, don't you?
Yeah, sure.
Good. So if for anything that you say, you need to back it with evidence, and one of those is references. Okay.
It's okay.
Okay. So let's look at the socio-economic factors. So in analyzing the influences of development or perspective on contemporary, you have to look at the socio-economic factors. One of them is income disparities. Income disparities. Socioeconomic status influences access to healthcare services, perceptions of healthcare quality, healthcare outcomes. Individuals with higher incomes may have greater access to private healthcare or renting. You know, in the UK, apart from the NHS, which is the fundamental or foundational healthcare for all, okay, who
Yeah.
are resident in the UK, there are some people who also, due to their salary income or they think they have a lot of money, we still can also choose to go to private sectors. You know that.
Sure. Yeah.
Exactly. So that's what the income disparity means. Because some may have higher salary than others. Those who feel that they have enough money and would want to take additional private hospitals or attend private hospitals or specialists beyond the NHS, you have the right to do so. And this is a socioeconomic issue, okay?
Okay.
Exactly. Because of higher income, some may have greater access to certain things than others, isn't it?
Yeah.
And therefore, there's a gap, there's a disparity between the normal salary worker and the huge salary worker. And so those can have an impact within the healthcare. In that, if, for instance, there's an ailment that requires a private sector or a specialist, you are not able to, okay?
Yeah.
Yes, it affects. And
Perfect.
let's
Yeah.
look at the educational level. Education correlates with health, literacy, and awareness, influencing individuals' understanding of health issues, adhering to medical advice, engagement with healthcare systems. Okay. And so, where education level has influence of understanding the healthcare adherence to medical advice. Because I mean, if you don't lack, or if you lack much educational or control of your education is very low, sometimes the advice they give you, you may not understand it. Okay.
Sure.
Yeah, in terms of medication and many other
Medication, yeah.
things. So it really affects a person. The educational level can even. So some people may need interpreters, okay,
Yeah.
or translators to even help them, you know, and all that.
Yeah.
Yeah. Then we have the employment status. Job stability and benefits impact access to employee sponsored of insurance, which affects individuals' health utilization patterns and perspective on healthcare. Again, it's a problem. I mean, you may still enjoy the NHS for free if you are not working or if your job is not stability. However, it still has some impact on your healthcare. Okay,
Yeah.
it may still have an impact on your healthcare because um, not everybody would have the money to even buy the medicine that has been prescribed for them. You know what I mean? Yes, not everyone may have. Are you there, Atta?
Yeah. I'm here. Yeah.
Not everyone may have the money, okay, to
Yeah.
be able to buy medicine
Medicine.
when doctors prescribe. Some of those medicine may be very expensive, okay,
Yeah.
and
Yeah.
you have it on routine regularly.
Sure.
Idea. So others may qualify for some exemption or support, but not everyone. Not everyone.
Everyone.
So it becomes a problem when you don't have a stable job, okay?
Yeah.
Then cultural beliefs, okay? Look at that.
Yeah.
Cultural beliefs about health, illness, and the role of healthcare providers shape individuals' attitudes towards seeking medical care, adherence to treatment plans, and acceptance of certain healthcare practices. Of course, people have cultural belief differently. Come from Nigeria, some from Ghana, and so some of these cultural beliefs may impact or impede your adherence to treatment. Okay,
Yeah.
the Jehovah Witness will say that Jehovah Witness, I think they don't give blood. If I'm right,
Sure.
don't accept blood from anyone.
Anyone. Yeah.
Exactly. So these are cultural beliefs, isn't it? These are
Yeah.
religion beliefs,
Religion
isn't it?
believes. Yeah.
Yeah,
Yeah.
and maybe a person is sick seriously and they need blood. Okay,
They need that.
exactly. And so these are some of the examples, and because of that, the person can die.
Yeah.
So the cultural or religion beliefs may impede the progress of treatment and the plans that doctors may have for you, and that can lead you. So these are all things that we need to think about it. So this is a question that if the question is thrown for you in that regard, you can answer the questions and make your submissions. Okay.
Sure. Yeah.
Exactly. Stigma. Again, we all know the stigma that is attached. When we say stigma, what are the associated issues or health issues such as mental illness or substance abuse affects individuals' willingness to seek help? And so, because some people don't want their stigma, their issues to be going out. They want to keep things secret. So even if
Yeah.
they are dying, imagine HIV/AIDS. Okay,
Yeah.
the person may feel shy. Okay,
Sorry to tell you.
to him or her, it's a stigma, isn't it?
Yeah. Sure.
And they are feeling shy to open up, and that is some
Okay.
of the things that affects also um one's well-being, and they need advice. But because of the stigma that they feel, somebody get to know about it, and therefore use against them, they keep it, and that really affects also health conditions. Okay,
Yeah.
family and community support, social support networks within families and communities influence individuals' coping mechanisms, access to healthcare information, and healthcare decision making. Of course, I mean, family come first when it comes to healthcare issues. If you are married, your wife is the first. If you are not married, your family. Okay, your
Yeah.
father, your mother, your next of kin, your brother. So these are all people that may have influences in your decision making. Okay, or
Yeah.
your next of kin. And it's important that um, those informations are shared with these families, and that help you. So they can either impact you or advise you negatively or positively. Okay.
Yeah.
Still have influences concerning. Then let's look at government policies. Healthcare policies and reforms were made by government to affect availability, affordability, and quality of healthcare services. Public perceptions of government actions on healthcare can vary based on political ideologies and party affiliations. Okay. So again, government policies are made to ensure that those policies are done to help the citizenry concerning availability, access to available healthcare, affordability of pricing and everything, and quality of healthcare services. But the
Yeah.
public perceptions of government actions on healthcare are very based on political ideologies and party affiliations, of course. So
Yeah.
that if they feel that the policy that have been made, people are traveling the same party affiliation or leaders, when they have ailment, they travel abroad for treatment, isn't it?
Yeah.
Exactly. It can affect. So the policies are made. If the policies are okay, why would the governors and the MPs and all that, when they are ill or the families are, would they travel them abroad for treatment, isn't it?
Treatment. Sure.
So
Yeah.
these things are all things that affect. It is not the best. Okay.
Mhm.
Also, with the political ideologies is the same. The
The same. Yeah.
illogical differences regarding the role of government in healthcare provision, the balance between individual responsibility and societal welfare, and the allocation of healthcare resources shape public discourse and policy debates on health issues. Okay. So the political ideologies also, which is still government, because the political ideologies relates to government healthcare provision, the balance between the individual responsibility and the societal welfare. Okay. And the
Yeah.
allocation of healthcare resources shape the public discourse and policy debates on health issues. So again, these are all things that people within a country or a nation look at. Okay.
Yeah.
They look at those ideologies. Are they helpful or are they not helpful within the country? If they are not helpful, then you can tell that it has been framed such a way that the political ideologies are only favoring one set of people and it's not fit the average person within the country. And it is very worrying. And then those societal welfare are not being achieved. Okay,
Okay.
are not being achieved. And so these are things that we can look into and then we can address them in our considerations. Okay. Then let's look at media representation. Media portrayal of health issues influences public perceptions, shaping attitudes towards healthcare providers. Treatment options and public health interventions. Biases in media coverage can perpetuate misinformation or contribute to public panic during health crisis. Okay, so media portray health issues influences public perception, of course,
Same thing.
shaping attitudes towards healthcare providers, treatment options, and public health interventions. Biases, if the media is biased in reporting what is right and it is twisted out there, obviously the public will have a different bad perception about the healthcare
Mhm.
sector, isn't it?
Yeah. Yeah.
Do you have any example of that that you can remember of anything that has been reported within the healthcare?
Uh, Not, not really.
Nothing, right?
No, no. Mhm.
Do you have any?
No. No.
Okay, just one minute. Let me just. So you don't have. There have been lots of. If you're in the UK, there's been a lot of what do you call it? Reports, okay?
Mm-hmm.
Within the healthcare concern a lot. There have been allegations of people who are born to work and they've maltreated. Have you not heard of all
Yeah,
those
sure, yeah.
maltreated patients and there'll be video
Patients, yeah,
coverages? Yeah, it's been all over. So
yeah.
these things, it creates some kind of bad perception, isn't it?
Bad perceptions, yeah.
Yes,
Okay.
about carers,
Okay.
because exactly, because with that, the public may think that all carers are bad, isn't
I
it?
mean, yeah,
Exactly, exactly. So when such things happen, then it creates more scrutiny against carers. And it's
carers,
not
yeah.
good that you work places where they have to put camera on you. It's not the best, isn't it?
Yeah, no.
Exactly. It's if you are working in a place and there's a camera, you feel comfortable. You won't.
No.
Exactly. You won't feel comfortable. You are like you become very worried because you're working a place, you're not yourself because there's a camera there watching you. So it really
Mhm.
affects. Okay.
Yeah,
Same with social media as well.
yeah, yeah.
Exactly. So putting information there without no cross-checking from the media or social media is a bit worrying.
That's very,
It's a bit worrying. And that can affect the level of healthcare provision. It can bring a sharp decline in the job intakes. And then a lot of people may be even afraid to apply to be carers, isn't it?
carers, yeah.
Exactly. A lot of people. So it can become, and that is why a lot more companies have to recruit from abroad, isn't it?
Yeah,
Because maybe many of the local people
people,
in the UK do not want
they
to work
know
in
how to,
healthcare, isn't it?
yeah.
And therefore, companies were struggling, and then they have to
Mhm.
bring about people from abroad. So these are things that we have to look into. Okay.
Yeah,
Then let's look at the healthcare characteristics. Healthcare access. We spoke about the availability and affordability of healthcare service by government policies. Okay.
yeah.
Those should include the primary care. When we say the primary care, then we're talking about the NHS. Okay.
NHS, yeah, okay.
Yes. Those are the primary care. Your NHS, the GP, you know what I mean? They all
Yeah,
fall under primary care. Then your specialty care, specialized um, um, wing of government. Then you have the preventive services that impact individuals' perceptions of the healthcare systems, effectiveness and responsiveness to their needs. There have been a lot of backlash on NHS for the minute time that I know. And one of those is the high waiting where you need to wait before you are attended to. You know what I mean? Because
mhm.
they lack a lot of nurses and carers. If
Yeah,
you go to the
carers,
AAE now, see how long you have to wait before you are attended to. Okay,
yeah, yeah.
exactly. So those things are all healthcare availabilities that we need to look into and address. And are they affordable in terms of the price? Yes, you are not paying, but then are they
Mhm.
affordable? For you to pay in the national contest? Are they affordable?
Exactly. Yeah,
Okay.
yeah.
Do you have any question?
Mm, not now. I don't have any question now.
Okay, so let's look at quality of care. Perceptions of healthcare quality, including waiting times. As you understand what I'm saying? The
Yeah,
waiting times, the patient and provider perception
perception.
interactions. You observe, do the carers interact with the patients? Okay.
Yeah,
How the treatment outcomes shape individuals' trust in healthcare. Are you able to develop trust
still,
between carers
yeah,
and patients or between nurses and
impatient.
patients? So those are things that we need to take note of. Then we can look at the personal experiences and healthcare status. Healthcare experience. Individual with personal experiences within the healthcare system, including positive or negative interactions within the healthcare providers, influence their trust in the healthcare institution and their willingness to engage with healthcare services. Healthcare status. You know, um, Personal health status and experiences with illness or chronic conditions can shape individual perspectives on healthcare priorities, resource allocation, policy decisions affecting health delivery. So while we're talking about healthcare experience, which is more to see how positive and negative interactions in our work as carers or nurses or doctors, we have to make sure we leave positive impact in the lives of the patients we take care of, isn't it?
Yeah.
Yeah, positively. You are there to support the patients. You are there to ensure that the patients recover well. You are there, whether supported living or care home, you are there to ensure that you leave a mark, help them with their independence, help them with their personal care, positive, they're not negative.
Okay. Mhm. Yeah.
Okay.
Yeah.
Yes. You help them to shape their life.
Yeah.
So
Yeah.
that's what we do as carers. Okay.
Yeah.
All right. So let's look at the global and historical context. In pandemics and a global health crisis, something like the outbreak of infection disease such as the HIV/AIDS pandemic shape public perception. We spoke about it already, isn't it?
Yeah.
Of health risks, government responses, and international cooperation in addressing the health challenges. So, yes, of course, those may have impact within the healthcare and can shape the public perceptions of health risks, government responses, and the international cooperation on addressing the health challenges. So those are very important. We have to look at. Then let's look at historical events. Historical events such as the healthcare reforms, public health campaigns, or instances of medical malpractice contribute to collectively memory and shape societal attitudes towards healthcare systems and providers. Okay. So by considering these multifaceted factors, you can gain a deeper understanding of how perspectives or contemporary issues in health and social care are shaped and evolved within society. And to be able to analyze this can inform efforts to address healthcare disparities, promote healthcare quality, foster informed public discourse, and then health-related matters. Okay.
Yeah.
Okay. So when we say disparities, we're looking about job salaries and all that. When we're looking about promoting health equity, making sure that everybody is treated fairly, isn't it?
Yeah.
Regardless of their salary intake, and one person should not have full access to certain job healthcare facilities than the other. We spoke
Mhm.
about foster informed public discourse, where we're talking about the outbreak of and the perceptions people may have concerning the healthcare, and then the health related matters that we spoke about. Some are the chronic diseases like HIV, and then the COVID-19 and all that. Okay.
Yeah.
They all have a way of affecting you or affecting the healthcare industry. So let's crack on. Now we want to have a proper as intake or a proper diversion and dive into the assessing public response to contemporary issues within the health and social care involves examining how individuals, communities, society as a whole perceive, react to, and engage with these issues. So let's look at surveys. Okay.
Yeah.
Okay. So surveys have also impact. One of it is that you conduct surveys or polls to gauge public opinions, attitudes, and awareness of specific health and social care issues. Ask
Yeah.
questions about the individual's concerns, priorities, and perception of the effectiveness of our government policies. So surveys where you put in samples or questionnaire to see
Okay.
the feedback. Some you can in your employment you can say feedback forms. Okay,
Yeah. Feedback.
feedback forms. Yeah, when you put that feedback forms to the parents or the family members of the carers you take off to know how they feel in the care home or supported living, how they feel their friend or brother or relative have been treated. They will give you a feedback, isn't it?
Yeah. Yeah.
And then it helps you, it shapes the organization or the country. Media analysis. Analyze the media coverage of health and social care issues to understand how these topics are portrayed and discussed in mainstream media outlets. Assess the tone, framing, and prominence given to different issues, as well as any patterns of bias and sensationalism. Okay, so you have to analyze it. How the media coverage of health and social care issues are, to understand how these topics are portrayed and discussed in mainstream media outlets, and assess the tone, the framing, and the prominence given to different issues, as well as so you realize that if you are able to analyze how the media portray or carry out, so to speak, when issues come out against or against the healthcare sector, how do they? You then realize that they very particular concern about certain things. For instance, abuse. Okay,
Yeah.
when they abuse, they take it very serious, isn't it?
Yeah.
Exactly, and safeguarding, isn't it?
Safeguarding.
Exactly, exactly. So those are what we call media analysis. Same with social media monitoring. You need to monitor to track discussion that is going on within the healthcare. You have to monitor what are the new policies that is going on that you don't even know. New government policy, new government frameworks, and all that. When you monitor, you get to know the trends, what people are saying, and the hashtags and all that concerning the healthcare industry, or what campaigns that are going on within the healthcare industry. Also, focal groups, conduct focal groups or interviews with diverse groups of individuals to explore perspectives, experiences, and reactions to specific health social care issues. Probe deeper into underlying attitudes, values, and beliefs that inform their opinions and responses. Okay, these are very important. Okay, so let's crack on. Community engagement. We spoke about this. Engage the community, very, very important. Engage with the community organizations, advocacy groups, and grassroots initiatives working on health and social care issues. Attend public meetings, town halls, or community reforms to listen to community voices, concerns, and suggestions for addressing local needs. You understand it?
Yeah.
Okay. Public demonstrations and activism. You need to pay attention to public demonstration. When there are demonstrations against self-care, against the government, you need to take attention to. It may be rallies, it may be protest groups against fighting against some certain policies that is not helping. You need to pay attention. You need to be concerned about that, because these things informs you to know what's happening. Okay.
Yeah.
And yes, and what changes people are asking for, especially it's about the public. Very important. The government feedbacks. Government may respond to certain things that is going on. So the feedback, the government, you have to evaluate those feedbacks. What are the responses of government when there have been protests and campaigns and all that? What was the response of government and what they said in addressing those meetings? Some may be town hall meetings, some may be engaging policymakers. You have to analyze those responses received and the extent to which those influences affect in decision making. So government feedbacks are very important. You need to pay attention, listen, research to know the government feedbacks on issues that have been reported or that have been taken to the national level in terms of campaigns and protests and all that. Okay. Opinions, editorials, and letters to the editor. Review opinion editorials, letters to the editor, public contemporary in newspapers, magazines, and online publications to understand the individual viewpoints and arguments on health and social care issues. Identify recurring themes, arguments, and also, again, you can get some information from the editorial writing, editorials online, and even books, or the daily the newspapers that we normally get them free from the buses and all that. You need to be reading. When you read that, you can see some information put out there, arguments, and you can write to the editor and gather more information. Public opinion research studies, quantitative data analysis, which is more about research, data such as health surveys, census data, or administrative records to identify patterns and disparities in access to health and social care, health outcomes, and social determinants. Okay, very important. So in conclusion, we can say by employing these methods, you can get insight into the diversity of public responses to contemporary issues in health and social care. You can also identify the areas of consensus or disagreements and inform evidence-based strategies for addressing public concerns and improving the health and healthcare policy services. Okay.
Yeah.
Now let's look at evaluating the impact of media reporting. We spoke about that, and I said this part of it would gain you a merit qualification. Okay. If you
Yeah.
are able to evaluate that, you're able to get beyond a pass mark to achieving a merit qualification. Okay. So let's look at content analysis in media reporting. We should conduct a content analysis of the media coverage on specific health and social care issues, examine news articles, television reports, online blogs, and social media posts related to the topic. So you need to look at the context of those information that is out there. You need to examine them, whether it's a TV report, online blogs, examine them to ensure, okay, that particular, it may be abused, it may be safeguarding. You need to examine and ensure that you have do what we call content analysis. It assess the tone, the framing, the language that was used. Was this very harsh? Was it very rude? Are they so serious about the issue? To determine the coverage, emphasis, fear mongering, or does it create any fear within the health and social care that a lot of people may be afraid? Is there a lot of abuse that is going on that raises concern? So these are things you have to. And then the reporting, is it biased or is it twisted just to suit some people against the healthcare, against carers? Is there any stereotypes? Is there any stigma? Consider the certain groups or individuals that are portrayed, and whether diverse. Is it about racism? Are they more talking more about African people? You know what I mean?
Yeah.
Black African. So you need to assess all this. It's called content analysis to
Sure.
know. Okay.
Mhm.
Then audience reception. Steady audience reception of media reporting through surveys. We've spoken about that, through questionnaires, through a quantitative analysis and all that. You have to then explore how individuals interpret and respond to the information presented in the media. Determine whether media reporting influences public awareness, attitudes, behavior related to health and social care issues. Assess whether individuals feel informed, anxious, motivated to take action, or indifferent based on media coverage. Okay, so again, you are determining whether the media reporting influences public awareness. Yes, it does, doesn't it?
Yeah.
Your attitudes, and it does. 100% it
That's
does. Then you have to assess whether individuals feel informed, anxious. Of course, you will feel informed, you will feel anxious. When there are so many issues concerning healthcare, and maybe there have been a lot of Black people and all that. Yes,
Yeah, they're going to be worried.
exactly. Thank you. You begin to worry. You begin to worry 100%. You begin to worry. Very, very important. You begin to worry 100%. Now, let's look at the demographic factors such as age, education level, socio-economic status that may influence how different segments of the population engage with media reporting. Of course, the age factor, the demographic in the area, the age factor and all that. Are they these media reports against certain age people, as it certain young people or certainly old people? So these are all things that it becomes more of a concern. For instance, if it is alleged in the public that a lot more younger people are being abused, within the healthcare. And then if you work with the children department, you have to be more careful, isn't it?
Yeah.
Exactly. Exactly. Public opinion shift. We've spoken about it. Public opinion, how to analyze those opinions, comparative analysis, compare media reporting across different outlets or platforms, e.g., traditional media, social media, alternative media, to assess how variations in presentation style, editorial stance, audience visual impact, and reform. 1 minute. Is it Abimbola? Abimbola, can you hear me? Hello? Abimbola, can you hear me? Hello? Atta, just bear with me, right?
Okay.
Yeah, so we have to look at compare media reporting across different outlets and platforms in the news media, social media, alternative media, to assess how variations in presentation style, editorial insight, examine how media reporting differs across regions, countries, or cultural contexts. Of course, we have different media reporting style from Nigeria, Ghana, and the UK, okay?
Yeah.
Consider how cultural norms, political system, media regulations shape the portrayal of health and social care issues, and public reactions to shape the portrayal of health and social care issues and public reactions to them. Very important. You have to take a note of this. Okay. Expert perspective. Seek input from experts in media studies, public health, sociology, or communication studies to gain insight into the mechanisms through which media reporting influences public responses. Consider expert assessment of the accuracy, credibility, ethical implications of media coverage on health and social care issues. Evaluate the role of media gatekeepers, journalists, and opinion leaders in shaping public. So you need to listen, the journalists, you have to listen to them. The gatekeepers, when we say gatekeepers, those who hold the fort, the key people within the media and all that, how the opinions matters to be able to assess them, the role of the media gatekeepers. Consider expert assessment of the accuracy. When there are issues, you need to look at the experts, those who are talking about it, those who are giving their opinions and giving their strategies in addressing issues. Okay. Then let's look
Yeah.
at public policy implications. Once you're able to assess the implications of media reporting on social media care issues for policy development, policy health interventions, and healthcare delivery. Very, very important. The media, what they seek to do is they must contribute their quota to the political discourse. So consider whether the media coverage facilitates informed decision making among policymakers, mobilize public support for policy initiatives, or exacerbates political polarization and policy gridlock. Okay. Explore strategies for improving media literacy, promoting responsible journalism, and fostering constructive public dialogue on complex health and social care issues. Very, very important. We need to make sure that we've explored the strategies in improving the media literacy, promoting responsible journalism, and fostering constructive public dialogue on complex issues. So it should be constructive, even if the media are talking about the negative stuffs about the healthcare, it needs to be constructive, okay? The
Yeah.
word constructive is the one unbiased, okay?
Bias, yeah.
Constructive, yeah. So that it doesn't turn people off within the healthcare. People are going to get scared to go to work. There's a lot of things that has been said about carers, and therefore it will lead to a lot of reforms and all that. She's very
Yeah.
worried. Okay.
Yeah.
No. So by evaluating the impact of media reporting on public responses in a comprehensive manner, you can gain a nuanced understanding of how the media shapes public discourse, influences public perceptions, and affects the policy making again process in realm of health and social care. Okay, just 1 minute. In health and social care. So in so doing, one, you need to understand that the evaluation impact within the public responses will have impact on the very gain, and that's very, very important. That's very, very, very important. Okay.
Okay.
All right. So we are looking at the issues that reporting in the media could have on healthcare and the healthcare. You understand me?
Yeah.
And why we need to be concerned about them, isn't it?
Concerned
Why
about
we
it.
need to be monitoring, we need to be
But,
reading, isn't it?
yeah.
It is possible that you can be a carer, but you don't even know what is happening. You understand
Yeah.
what is
Yeah.
happening, and that is not good. As a carer, you need to be concerned what is out there,
Yeah.
isn't it?
Yeah. Yeah.
What are the perceptions? What are people
Okay.
saying?
Saying,
So
yeah.
it involves, yeah, it helps you. It helps the
Mhm.
organization as well. If
Yeah.
there's a lot of abuse going on, a lot of public outcry, they are
Mhm.
not happy with organizations and healthcares and all that. You need to know about this. It helps you.
Yeah.
It's from you need to read. You need to take surveys. You need to understand. Same way in organization, you do internal examination, you do feedback, you do questionnaire and all that. That's the same way you need to be concerned about the media, because the media are the third highest people in organization. They can either make decisions by what they say, and that can affect healthcare. Okay.
Healthcare, yeah, sure.
Yeah. Yeah. So we are done, and these are the references. If you go to your model, you get all these references there. Okay.
Okay.
Yes, you have the remark, you have Gatcher, you have Warlock, and from all these references. And look at the reference style. This is what we call the Harvard type of reference. Okay.
Harvard. Okay.
Yeah, the Harvard type of reference. You understand me?
Okay.
The Harvard type of reference.
Thanks. Okay.
Exactly. You see the style of references.
Sure.
We call it the Harvard type of references. That's how we call it. Yeah. So we are done. And then so we've looked at we expect that before you complete your last learning outcome, which is let's LO3, from 2 weeks from that time, that's when you submit we're going to have one more lecture, which is called assignment discussions.
Okay.
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 Assignment discussions, yes. And when that is done, then you can do your full submission. But then for every lecture that we've done, nothing stops you from going to look at the question for those particular lecture. You can start attending to that with the assignment if you want. Okay. And
Okay.
every information that you need will be on student model. Okay.
Okay.
References and all that information here. And I'm on the group. You can also message me if you need any support. Okay.
Okay.
All right.
All right. Okay.
All right. I wish you all the best. Okay.
All right. Okay. All right. Thank
All
you.
right. All right. Have a lovely lecture. So
Okay.
I think our next lecture will be on Monday, right? Or when?
Thursday.
Thursday. Okay, that's fine.
Yeah,
All right.
because they
All
give
right.
us Thursdays and Fridays.
Thursdays and Fridays. So my next lecture will be on Thursday. Okay.
Thursday, yeah.
All right. Have a lovely day. All right.
Okay.
All right.
Thank you
Take
very
care.
much.
Take care.
Mhm.
Bye bye. 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 Yeah, bro. Um. Yeah. Yes, please. Mhm. not really most of us, yeah.